everybody. I am so glad that you all were able to attend this morning as we dive into talking about high blood pressure. Welcome. Thank you for taking the time out of your busy schedule to attend this webinar this morning. This will be the first of hopefully a few more webinars to come in the future so that we can have brief little discussions about health topics that affect us. I'm trying to tailor it more towards our population, the African American community. I think a lot of education is needed and would be appreciated regarding these health issues. But it is, of course, applicable to any others who may be watching as well. All right, so let's get going. So we are going to be talking about high blood pressure. Let's talk about it. All right, next slide, Nikki. Okay, so before I get going and discussing hypertension or high blood pressure, this is a brief reminder that this information is to be used for educational purposes, for informative measures, and is not meant to take the place of the advice or recommendations from your healthcare provider, from your primary care doctor. If you don't have one, this information definitely serves to educate you, but I recommend finding a family care provider, whether it's a primary care doctor, nurse practitioner, physician's assistant, someone who can take charge and help you with your health. Follow up with your doctor on a regular basis to ensure you are up to date with your recommended health goals. And if you should have any questions or need clarification after this presentation, you can reach out to the Abner Baptist Church Health Ministry. And there will be more information to come with a way that you can do that in a private manner. If you have any questions, we are going to set up a direct email account so that you can email your questions or concerns, and that information would be kept confidential. Okay, and next slide. Okay, I think we have a few more people in the waiting room, Nikki. Are we able to admit them?
I don't, hold on.
I'm going to hold off on getting started. If we need to admit them and then come back to the screen, that's fine.
All right, I'm going to stop.
Okay.
All right, okay.
Welcome those who are joining.
Good morning.
Good morning.
Good morning.
Good morning. Good morning.
Good morning.
Good morning, everyone. Thanks for taking time out of your schedule to join us. I had just made a quick announcement just before I get started here that the information I'm presenting is for informational purposes to help you become educated and use this information to make informed decisions about your health regarding your blood pressure. But please don't let this information substitute or take the place of recommendations or advice from your primary care doctor. If you don't have one, please find one, nurse practitioner, physician, physician assistant, someone to guide you on your better health. Okay, high blood pressure is a cause for concern for many Americans, but we see specifically in the African American population, it is prevalent and creates more complications, with severe complications being at the forefront for African Americans. Why that is can be related to perhaps our cultural norms, the foods that we eat, maybe the way our body is made. There's some thought in the literature that our makeup, our genetics lends us to more instances of high blood pressure and severe complications from having high blood pressure. So because we know that it's prevalent in our community, in the African American community, We need to recognize that and take charge of our health to say, what can we do to decrease our risk for complications for high blood pressure in our community, in our families? We know, again, that the complications are more severe when they do happen from uncontrolled hypertension in African Americans. Oftentimes with having high blood pressure or hypertension, I'll be using those terms interchangeably, by the way. Hypertension and high blood pressure meaning the same thing. Hypertension is just a medical diagnosis term for it, but we refer to it as high blood pressure. So having high blood pressure oftentimes will be in conjunction with other issues, diabetes, kidney disease, high cholesterol. So those are all instances of situations that we need to be mindful of, that if there's one, there might be a chance where there's something else that we need to pay attention to and have diagnosed and treat if needed. It's important to know in the African American population as well that not all blood pressure medication will work well for us. There are some medications that may work better in the Caucasian community, but not so much so in the African American community. And I can think of a few medications that African Americans are started on to help control their blood pressure. And we notice, okay, it's not really working, their blood pressure is still high. Your doctor may keep trying to increase the dose and may not be getting anywhere with your blood pressure. And it's time to take a look at other alternatives, other medications that work better for our population. Okay, next slide. Next slide, Nikki. Okay, great, thank you. All right, so what exactly is blood pressure? We hear talk about high blood pressure, but what exactly is blood pressure? What is it referring to? So blood pressure refers to the amount of pressure that's exerted on your arteries, on the vessels in the body that carry oxygenated, rich blood throughout the body. We need the blood to pump from the heart, to be forced out of the heart and travel throughout our bloodstream, our vessels, our arteries, to perfuse or feed our organs with nice, rich, oxygenated blood so that those organs can function properly. We can go back to the next slide there. Thank you. So blood pressure is measured when the heart beats, when the heart contracts. It's going to contract and squeeze and eject blood out of the ventricles. The left ventricle of the heart, the blood is pushed out so it can start flowing through the body. When the heart contracts and pushes that blood out, the amount of force that's used to push that blood out, the pressure that's exerted, is the systolic blood pressure. That's that top number. We always look at the top number and the bottom number. So the top number is when the heart contracts and pushes the blood out. When the blood is pushed out, that heart, those vessels are going to relax and blood is going to fill up again in the heart to be exerted out or pushed out of the heart again. When the heart rests and blood is filling back up in the heart and the vessels are relaxed, that refers to the diastolic pressure, the bottom number. Spend too much time on the anatomy and trying to understand what number really signifies something, and we need to pay attention to what those numbers are. So what is a good blood pressure? Good blood pressure. Everyone is concerned about 120 over 80, or should be. That is the recommendation from the American Heart Association. And actually now the guidelines are suggesting to have a blood pressure lower than 120 over 80 to prevent a diagnosis of high blood pressure or hypertension. So that number is considered normal. If you look at the graphic or the chart to the left, the green area that says normal refers to that top number being less than 120. The bottom number, less than 80. So if you're normally 120 over 80 or less without the use of any medication to help you get there, then you are not considered to have hypertension or high blood pressure. As we start to move through the chart to the next color, elevated, which is the yellow section, a range of 120 to 129 for that top number, and still less than 80 for your bottom number, you're elevated. Doesn't mean that you have hypertension, but you're on your way there. So you can start making some changes to prevent going into the next stage, which is high blood pressure stage 1. Having a top number between 130 and 139, and the bottom number between 80 and 89. It's at that stage that generally your doctor may suggest making some lifestyle changes, start exercising, adjusting the foods that you eat to decrease that number. Or if it's severe enough, or if you have other health issues, diabetes, high cholesterol, number, the bottom number 9, that's stage 2. Definitely exercise, lose weight, eat right, but you'll be on medication likely at that stage as well. Hypertension crisis or a hypertensive crisis, a blood pressure higher than 180, especially if you have symptoms, you will be definitely sent to the emergency room, or you should go to the emergency room with symptoms, shortness of breath, chest pain, headache, numbness in your arms, any of those symptoms, especially if your blood pressure is that high, you would need to go to the emergency room or call 911 for help. It's important to remember that blood pressure is different for each person. The goal will be set for you by your doctor. If you have other health issues, your doctor may want your number to be within a certain range that may be different from this chart. So it's important that you pay attention to the recommendation of your doctor. And also, again, it's important to know that there are other health issues that can contribute to hypertension, such as heart disease, diabetes, or kidney failure. Okay, next slide. And I think I'm getting a message here for some bad audio. Can you all hear me okay?
Yes, but
okay. So hopefully you can hear me a little better. Let me move this over here. Okay. Sorry about that. Hopefully this is better now for you. Okay, so we'll discuss now risk factors for high blood pressure. So high blood pressure are going to be caused by two sets of factors. Those factors or risk factors that are modifiable, those that we can control, and those that we can't control. Those we can do nothing about. That's just how they are. We can't change them, but it's important to focus on those risk factors that are modifiable. So at the top of this list here, we have those that can be controlled: cigarette smoking and exposure to secondhand smoke. Cigarette smoking. If you can quit, quit. If you can't quit and it's hard for you, at least start by decreasing the number of cigarettes that you're smoking. Cigarettes have a component in it that is nicotine. Nicotine is something that we refer to as a vasoconstrictor. It actually starts to narrow the vessels in your body and decreases the flow of blood in a nice smooth way throughout your arteries and your vessels, and really contributes to resistance in your vessels and causes your blood pressure to be increased. So quitting smoking will definitely help you decrease your risk for hypertension, or if you already have it, at least help improve your blood pressure numbers. Diabetes. Diabetes, if you are diabetic, take control of your diabetes. Take your medication, avoid those high carbohydrate foods. Diabetes, long-term diabetes causes inflammation in your vessels over time. That, along with having high blood pressure, causes some detrimental effects on your vessels over time. You can't see it. You can walk around each day and feel okay, But at the microscopic level, at the level of your vessels that you can't see, changes are being made to your vessels, and that increases the risk for heart disease, peripheral vascular disease, coronary artery disease. So we're trying to decrease the inflammation in your vessels. Diabetes causes long-term inflammation in the vessels, as well as high blood pressure, high cholesterol. So those are things that we can control, we can change to prevent complications from having high blood pressure. Being obese and overweight, that definitely contributes as well. Having high cholesterol, eating an unhealthy diet, a diet high in sodium, too low in potassium, and drinking too much alcohol contributes to high blood pressure as well. And physical inactivity, so living a sedentary lifestyle, sitting, just watching TV, which I think a lot of us are probably doing more of during this pandemic, but really taking charge to get outside and get active will decrease your risk for high blood pressure as well. So factors that can't be modified, things we can't change, which contributes to high blood pressure, will be family history of having hypertension. If there's a familial history, it runs in the family, well, then you may already just be set up to have high blood pressure, but it doesn't mean you can't control it. Your race or ethnicity, again, African American, we have higher chances of having high blood pressure. So since we know that, we'll have to take some extra precautions to prevent having an out of control or skyrocketing high blood pressure. Increasing age, as we get older, our vessels stiffen over time. It's just going to happen. They lose some of their elasticity and they become a little stiff. So we're going to create some resistance in our blood vessels, which set us up for developing hypertension. We can't do anything about that, but we can control those factors that we can change. Not eating healthy, not exercising, smoking. So we can't change those things. We can't change being a male. Men are more likely to have hypertension. If you have, a kidney disease issue, whether it is genetic or secondary to other issues, or if you have sleep apnea. I can't tell you how many times patients, and mostly men, because we see it more often in men, come in to be seen and the neck size is large and maybe overweight and have some other health issues, but sleep apnea, if it's undiagnosed, can definitely cause a strain on the heart. The longer you go without treatment, causes a strain on the heart, increases hypertension, and sets you up for a multitude of health problems. So if you have sleep apnea and you have a CPAP machine, please make sure you use it. You'll feel better the next day because your brain has gotten that oxygen that it needs, and you'll have oxygenated, rich blood flow traveling throughout your body. Okay, next slide, please. Okay, so prevention. What can we do to prevent hypertension or worsening hypertension? Number one, see your doctor at least once a year. If you have a physician, nurse practitioner, physician assistant that you see, go at least once a year, stay on the books for your physical, don't cancel your appointment. Or if you have to cancel it, be sure to reschedule it. It is that appointment, that physical, where your doctor has the opportunity to ask you questions, do a quick check through, make sure everything is ticking the way it's supposed to be ticking and everything's working the way it's supposed to be working. If you don't go, we don't have a way of knowing what's going on with you. So it's that time that we can sit down, check your blood pressure, find out, has this been going on for a while? Is there anything else going on that I should know about? Is there a secondary cause that could be contributing to high blood pressure? So that physical appointment is so important to keep so your doctor can just sort of get an idea about your overall health. Exercise at least 30 minutes a day for a minimum of 3 days a week. If you can go longer than that, then by all means do it. Get out there and get moving. If you find that it's a little bit too much for you to do that, then start slow. Start with 5 minutes or 10 minutes, but just get out there and get walking. Aerobic activity, getting that heart rate up, is conditioning the heart, getting nice blood moving through your body, and getting your heart used to exercise and pumping out blood effectively. Now, of course, if you have a heart condition or any other health condition that limits your ability to move too quickly, or if you get out of breath too quickly, listen to your body. Know your limitations. Start off slow and work your way up. If you have heart failure, you have a pacemaker, or anything going on with your heart, start slow. But sitting still and doing nothing is the worst thing you can do. You have to get out and get moving, but talk with your doctor about what exercises would be best for you. And eating. We love to eat, don't we? I know I do. We all love to eat. So this plate over here to the left on your screen just refers to the general diet that you should eat for a heart-healthy diet. The majority of your plate should consist of vegetables, and then your whole grains and your fruits. If you're going to have meat, choose meat that is a healthy protein, a lean meat like your poultry, your chicken, or fish. Stay away or completely eliminate your red meats. Those are not good for you. They may taste good, and you may want to just treat yourself every now and then to a burger or to a steak, but please don't make it a regular habit. It really causes damage in the long run to your vessels, to your arteries, fat deposits, sets you up for complications in the long run. So when you get a moment, refer back to this slide, or you can go to the American Heart Association. My information has been pulled from their site as well, so that you can go back to that website and review suggested meals and things that you should eat for a heart-healthy diet. Okay, next slide, please. Okay, so management. If you have high blood pressure, you'll want to make sure it's managed. And you can manage your blood pressure by taking your medication as prescribed. And that's underlined because many patients, many people may not like certain blood pressure medications and will cut the pill in half or skip a pill, or don't want to take their water pill, which is the fluid pill, to help control blood pressure. But please don't do that. Don't do that, because by changing your medication, taking it the way that you want to take it, believe it or not, you're doing more than good. Blood pressure is controlled by types of blood pressure pills. So if you're prescribed more than one blood pressure pill, it's important to know these pills work differently. Believe it or not, some pills work directly on the receptors in the heart. Some work through the kidneys. Some work by relaxing your smooth muscles or your muscles in your body so blood will flow smoothly. So please take your medications the way they are prescribed and take all of them. Check your blood pressure morning and night. Keep a log and keep track of it. Take it to your doctor so your doctor can see your numbers. It's from that log will your doctor be able to make changes or increase or decrease your medication if needed. We really don't have a lot to go on if you just wait until your follow-up appointment. So keeping a log is so helpful and beneficial overall for your hypertension management. And most importantly, get moving, exercise. Again, that is so helpful to controlling high blood pressure. Okay, next slide, please. All right, so what are the complications of uncontrolled high blood pressure? Well, it is so important to know high blood pressure, left untreated, truly is the silent killer. Why do we call it that? Because so many people walk around enjoying life. There are no symptoms really of having high blood pressure until it creates damage in the body, and it causes complications. So you can walk around, have high blood pressure, damage is being done to your vessels and your arteries, and it's slowly but surely leading to death. And I hate to say that this morning, it sounds so morbid, but it's true and it needs to be discussed. You have to know that high blood pressure treated can cause death. To the left, there are complications that are highlighted from uncontrolled hypertension, stroke. There are two types of stroke, ischemic and hemorrhagic. Having blood clot in the brain because those vessels have been damaged from having high blood pressure will cause a clot, or the pressure is so high that it damages the vessels, cause them to be very weak and leaky. blood can sort of ooze out or the vessel can burst, and that's an aneurysm. And it's important to know they're both deadly, but they're both preventable as well. So controlling your high blood pressure, decreasing your risk by not smoking, reducing alcohol consumption, and losing weight will help decrease your risk for stroke and heart attack. So heart attack, heart failure, having uncontrolled hypertension over time damages the heart. It weakens the heart, causes it to get larger, and that's actually called left ventricular hypertrophy. The heart can enlarge and become not as effective as it once used to be. When the heart's no longer effective the way it used to be, that's heart failure. We want to prevent that. Heart attack, kidney disease, and believe it or not, vision loss. It's not just the arteries that are damaged throughout the body, but those vessels behind the eyes. They also are damaged from uncontrolled hypertension. So there are so many complications that can occur, not only at a young age from having high blood pressure, but later in life, when you want to enjoy your life later on in years to come, but you have these problems as a consequence from not controlling high blood pressure. So these are all so important to remember when you're looking at your medications, when your doctor's telling you your blood pressure is high. Think about these complications that may come if it's not controlled. Okay, next slide, please. While we're talking about the complications, I always want to take a moment to review the warning signs. Stroke, FAST, remember the acronym FAST, F. If there's any facial drooping on one side, you could be talking to someone, having a nice conversation, laughing, out to dinner. I mean, it can happen suddenly. It's important to recognize, his face or her face is drooping on one side. I wonder what's going on. Immediately think, stroke. They could be having a stroke. That might be the only symptom, but time is of the essence. If you notice that, call 911. Arm weakness. Have the person hold their arms out in front of you. If you notice that their face is drooping, or if they feel kind of funny, hold your arms out. If one arm sort of falls down, one arm is weaker than the other, or if there's numbness, sign of stroke. Speech is slurred, or if they're just not making sense. The words that they're saying don't make sense, or the sentence, the phrase structure doesn't make sense, that's a sign of stroke. T stands for time. Time is of the essence. It's so important to call 911 immediately. Stroke, especially if it's an ischemic stroke from a clot, time is so important. We can get them to the hospital quickly, get them into the emergency room, get them in for, cardiac cath if it's in the heart, to go and open up that vessel so blood can flow through again and save that area of the brain and save their life. So remember, for stroke, FAST, F-A-S-T. Remember that acronym. Stroke can happen to anyone at any age, at any time. Okay, heart attack. Signs of a heart attack, chest pain. Oftentimes you hear it feels like an elephant sitting on your chest, or someone will say, my chest hurts so bad, or they might not be able to speak. If they're having jaw pain, nausea, arm pain on one side, it used to be just the left, but it could be left or right, sudden back pain, or feeling like you're having really bad indigestion, heartburn, those are all signs of a possible heart attack, especially in the presence of risk factors. If you smoke, overweight, have high blood pressure that's not controlled or treated well, those symptoms should not be ignored. Call 911 immediately. Please don't ignore the symptoms. Don't say, oh, I just had a really long day. I ate something that my body doesn't agree with. I'll just go lay down and sleep it off. You might not wake up. And I hate to put it so bluntly, but if that happens and you know you have factors, just call 911 than sorry. So just please pay attention to the warning signs, remember them, post them on your refrigerator, hang them somewhere so that you can remember and get help when it's needed. Okay, next slide, please. Next, oh, there we go. Okay, so how do we check our blood pressure? That is a picture there to show you how to do it. But I have a video, Nikki, if we can pull that up. Just a real quick video. I think it's better explained as a visual than just talking you through it. But make sure you do have an automated blood pressure cuff, and preferably not a wrist. I mean, they have wrist ones now. I think they have ones that you can put somewhere on your neck, or to check your blood pressure. But really, the arm cuff is going to be most accurate because it's going to occlude or squeeze the brachial artery and will give you more of an accurate blood pressure. All right, let's see if we can get the video up.
You see the video?
Okay, let's have a real talk about blood pressure. Do you monitor yours regularly? It's something everyone with high blood pressure should do, but it's something most people don't know how to do correctly. Checking your blood pressure regularly will help let you know if you have it under control. It will also help you start to understand which factors are putting you at high risk for stroke and heart attack. Before I get to that though, I just want to stress one thing. If you have high blood pressure, you should talk to your doctor to figure out how frequently you should be checking it at home. For most people, taking your blood pressure twice in the morning and twice in the evening, even just for a week, will help you and your doctor get a better understanding of your blood pressure. For morning readings, it's best to take those before you take your blood pressure medication. It's also very important to avoid exercise, caffeine, or tobacco at least 30 minutes prior to testing, since those can affect your levels. Now, let's move on to talk about the proper way to measure your blood pressure at home. Nearly half adults in the U.S. have high blood pressure and are at high risk for stroke and heart attack. So self-measuring is one of the easiest ways to be proactive about our health. Here I have my blood pressure monitoring device. It's easy to use and it helps me get an accurate reading. Be sure to get an automated device with an upper arm cuff. That's the type doctors recommend. The first thing you want to do is find a quiet place to sit where your back is in an upright, stable position. A dining room chair is great. You want to make sure the chair isn't too soft so your body is fully supported. Sit with your feet flat on the floor and don't cross your legs or ankles. If you need to use the bathroom, make sure you go before you do your reading. Next, rest your arm on a flat surface with your palm facing up. Place the blood pressure cuff on your bare upper arm just above your elbow. Your arm should be relaxed and resting so the cuff is at the same height as your heart. Now rest quietly for 5 minutes before taking the first measurement. Avoid talking while taking your blood pressure measurement. Once your first measurement is completed, write down the blood pressure numbers and pulse that are displayed on the device. Wait 1 minute and then repeat this process again. As you just saw, it's important to check your two measurements at around the same time each morning and evening. At your next doctor's visit, be sure to share your blood pressure numbers so you can discuss the numbers and so your care plan can be changed if necessary. That's it. Not bad, right? Measuring your blood pressure at home is easy to do and a great way to stay on top of your health. If you have more questions about managing or measuring your blood pressure overall, visit the website.
Website, which I recommend visiting that website when you have a chance and find some helpful tips and resources to educate you on taking control of your blood pressure. Okay, next slide, please. So let's commit to living a heart-healthy life. Again, high blood pressure, one of the most common conditions, but one of the most conditions that we have control over. Choose to eat a healthy diet, DASH diet, Mediterranean, vegan, or being vegetarian. All of those diets will work well to help decrease risk for complications. Choose the diet that works best for you and stick with it. We want to prevent stroke, heart attack, heart failure, and other complications. Be sure to talk with your doctor, make that appointment, find a provider who's willing to take care of you, and you participate in shared decision-making. Speak with your doctor, offer up suggestions as well, and work together, and ultimately commit to a healthy lifestyle. Next slide, please. Those are the sources, links to the American Heart Association as well. And I want to thank you all for attending this webinar this morning. I hope this information was helpful and useful for you.